Let's face it, unprotected sex happens. It might not have been planned, but what matters now is what you do next. While it's always important to practice caution, there are immediate steps you can take to protect your health and prevent unwanted outcomes. Stick around, because in this video, we're breaking down exactly what to do after unprotected sex, so you can take control of the situation. Hi, welcome back to the Healthy Life Blueprint channel. And today we're talking about essential actions you should take right away to reduce the risk of pregnancy and sexually transmitted infections, or STIs. Now, this isn't a replacement for medical advice, but it's practical, need-to-know information that could make a huge difference in protecting your health. Step 1. Stay calm. The first and most important thing to remember is to stay calm. It's natural to feel overwhelmed or anxious, but panicking won't help. Taking a deep breath and focusing on the steps you can take right now is key. You have options to protect yourself, and acting quickly and thoughtfully will make a difference. Remember, unprotected sex doesn't have to define the outcome. You're in control of what happens next. Quick reminder, if this video is helpful or just entertaining, give it a like. It really supports the channel. And if you haven't joined the family yet, what are you waiting for? Hit that subscribe button and turn on notifications so you never miss out. Step 2. Preventing pregnancy. Now let's talk about preventing pregnancy. If pregnancy is a concern, the first step is to consider emergency contraception, or EC. You have a few options. Plan B, levonorgestrel. This is the most commonly used form of emergency contraception. It works best when taken within 72 hours after unprotected sex, but the sooner the better. Ella, ulipristal acetate. This is another effective option, especially if more time has passed. Ella can be taken up to 5 days after unprotected sex, but like Plan B, it's more effective the sooner you take it. Important note, neither Plan B nor Ella will work if ovulation has already occurred, so timing is critical. Another highly effective option is the copper IUD. If inserted by a healthcare provider within 5 days, it can prevent pregnancy and provide long-term birth control. If this is something you're considering, contact a doctor or clinic immediately to schedule an appointment. Step 3. Addressing STI risks. Preventing pregnancy is important, but for protecting yourself from sexually transmitted infections, STIs, is equally critical. Here's what to do. Immediate steps. After unprotected sex, urinating as soon as possible can help flush out bacteria and lower the risk of urinary tract infections, UTIs. Wash the genital area gently with mild soap and water, but avoid douching, as it can disturb the natural balance of bacteria and increase the risk of infection. Seek medical attention. If there's a risk of HIV exposure, visit a doctor or clinic as soon as possible to discuss post-exposure prophylaxis PEP. This medication can prevent HIV infection, but must be started within 72 hours. Get tested for other STIs like chlamydia, gonorrhea, and syphilis. Many of these infections can be treated with antibiotics if caught early. Step 4. Self-monitoring. After addressing immediate risks, it's important to keep an eye on your body for any signs of an infection. Monitor for unusual symptoms like discharge, sores, itching, or fever. If you notice anything out of the ordinary, reach out to a healthcare provider right away. Early detection and treatment can make a big difference in managing STIs. Step 5. Long-term prevention. To reduce the chances of facing this situation in the future, focus on long-term prevention strategies. Consistently use condoms during sex to protect against both STIs and unintended pregnancy. Consider long-term contraceptive options like birth control pills, implants, or an IUD. These methods provide ongoing pregnancy prevention and peace of mind. Open communication with your partner is key. Talk about sexual health, testing, and safe sex practices to ensure you're both on the same page. Common myths debunked. Before we wrap up, let's clear up a few common misconceptions. Drinking vinegar or taking hot showers to prevent pregnancy. These methods are ineffective and can harm your body. They don't prevent pregnancy or STIs. Douching. This is not a safe or effective way to prevent STIs. In fact, it can increase the risk of infection by disrupting the natural balance of bacteria in the vagina. Remember, accurate information and timely action are your best tools for protecting your health. Taking the right steps immediately after unprotected sex can make a huge difference in protecting your health and preventing unwanted outcomes. Remember to stay calm, act quickly, and seek medical advice when necessary. Knowledge is power, and being proactive is the best way to take control of your well-being. With that said, thanks for watching. Hit that like button, subscribe to the channel for more valuable content, and share your thoughts or questions in the comments below. And until next time, stay informed and take care of yourself.